Your doctor checked your heart health at your last appointment. They looked at your cholesterol, your blood pressure, your blood sugar, your heart rate, your BMI. They told you everything looked fine. 6 months later, you had a cardiac event. This is not a rare story. This happens to thousands of adults over 65 every single year. And in almost every case, the two numbers that would have predicted the event were already sitting inside the data the doctor collected. They were never calculated. They were never mentioned. And the patient never knew they existed. In this video, I'm going to show you exactly what those two numbers are, how to calculate them yourself from data you already have, and the specific questions to ask your doctor at your next appointment that could change everything about how your heart health is being monitored. As always, nothing in this video is medical advice. Always consult your physician before making any changes to your health routine. Let me start with something your doctor almost certainly has never said to you out loud. A blood pressure reading is not one number. It is two. And the gap between them, the mathematical difference between the top number and the bottom number, is itself a third measurement that most patients have never been told about. That gap has a name. It is called pulse pressure. If your blood pressure reading is 130/80, your pulse pressure is 50. If it is 140/85, your pulse pressure is 55. If it is 122/78, your pulse pressure is 44. You calculate it yourself in seconds. Top number minus bottom number, that is your pulse pressure. Now here's why it matters. Research published in the Journal of the American College of Cardiology found that pulse pressure is a stronger independent predictor of cardiovascular events in adults over 60 than either systolic or diastolic blood pressure alone. A pulse pressure above 60 millimeters of mercury in adults over 65 is associated with significantly elevated risk of heart attack, stroke, and heart failure. But here's what makes this clinically important in a way that most patients do not understand. A person can have a blood pressure reading that looks completely normal, 130/65, and have a pulse pressure of 65, which places them in an elevated risk category. The same reading that gets a reassuring nod from the doctor contains a warning that was never spoken. Research from the Framingham Heart Study, one of the longest-running cardiovascular studies in history, confirmed that elevated pulse pressure is an independent marker of arterial stiffness. Arteries that have lost their elasticity after decades of pressure cannot absorb the force of each heartbeat the way they were designed to. That lost elasticity shows up in the pulse pressure number before it shows up anywhere else. Write that down. Take out your last blood pressure reading right now. Subtract the bottom number from the top. That is your pulse pressure. If it is above 60, that is a specific conversation to have with your doctor at your very next appointment. Now here's the second number, and this one requires one additional question at your next blood draw. When you get a standard lipid panel, your doctor measures total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. All four numbers appear on your lab results, and most doctors focus almost entirely on LDL, the so-called bad cholesterol, when assessing cardiovascular risk. But research published in Circulation, the American Heart Association's flagship journal, found that the ratio of triglycerides to HDL cholesterol is a significantly stronger predictor of cardiovascular events and insulin resistance in older adults than LDL cholesterol alone. The calculation is straightforward. Divide your triglycerides number by your HDL number. The result is your triglyceride to HDL ratio. A ratio below 2.0 is considered optimal. Between 2.0 and 3.5 warrants attention. Above 3.5 in adults over 65 is associated with significantly elevated insulin resistance, cardiovascular inflammation, and arterial disease. Here's what is remarkable about both of these numbers. Neither requires a new test. Neither requires a new appointment. Neither requires additional cost. The pulse pressure is already in every single blood pressure reading your doctor has ever taken. The triglyceride to HDL ratio is already in every single lipid panel result in your medical record. Both numbers have been there the entire time, hiding inside data you already have, waiting for someone to calculate them. A 2024 review published in the European Journal of Preventive Cardiology found that integrating pulse pressure and triglyceride to HDL ratio into standard cardiovascular risk assessment for adults over 65 improved predictive accuracy by over 30% compared to standard five-factor assessment alone. Now, here is something important about why these numbers are not routinely discussed, and it has nothing to do with negligence. Cardiovascular guidelines have historically focused on LDL cholesterol because that is where the most pharmaceutical intervention is available. Statins lower LDL effectively, and there is enormous clinical and commercial infrastructure built around that. Pulse pressure and triglyceride to HDL ratio are not as directly actionable through medication. They are more directly addressed through lifestyle changes, which means they receive less clinical emphasis in a 12-minute appointment. But for adults over 65 specifically, the research is increasingly clear. Arterial stiffness as measured by pulse pressure and metabolic dysfunction as measured by triglyceride to HDL ratio are two of the most important modifiable risk factors available, and both respond meaningfully to the same set of lifestyle interventions. What specifically moves both numbers in the right direction? Research is consistent across multiple studies on four specific interventions. Interval walking, not steady-state cardio, interval walking, alternating between a brisk pace and a slower pace over a 30-minute walk, has been shown in a 2023 Journal of Hypertension study to reduce pulse pressure by an average of 8 millimeters of mercury over 12 weeks in adults over 60. That is a clinically meaningful reduction. Time-restricted eating. Consistent with the Blue Zone research covered in our last video, consuming all calories within a 10-hour window earlier in the day reduces triglyceride levels and improves HDL function in adults over 60 according to research published in Cell Metabolism. Omega-3 fatty acids, specifically EPA and DHA from either fatty fish or high-quality fish oil supplements. A 2024 meta-analysis in the American Journal of Clinical Nutrition found that omega-3 supplementation at 2 to 4 grams per day reduced triglyceride levels by an average of 25 to 30% in adults with elevated levels. Reducing refined carbohydrates specifically. Not all carbohydrates, refined carbohydrates. White bread, white rice, added sugar, and ultra-processed foods drive triglyceride elevation more directly than dietary fat in most older adults. Swapping refined carbohydrates for whole food alternatives consistently reduces the triglyceride to HDL ratio within 8 to 12 weeks. Here's your complete action plan for your next doctor appointment. Step 1. Calculate your pulse pressure right now. Find your most recent blood pressure reading. Subtract the bottom number from the top number. Write it down. If it is above 60, write these exact words on a piece of paper. I would like to discuss my pulse pressure and what it indicates about my arterial stiffness and cardiovascular risk. Step 2. Request your triglyceride to HDL ratio at your next blood draw. Your doctor already orders triglycerides and HDL as part of a standard lipid panel. Ask them to calculate the ratio and discuss it with you. Say exactly this: I have read that the triglyceride to HDL ratio is a stronger predictor of cardiovascular risk in adults over 65 than LDL alone. Can we discuss my ratio and what it means for my risk profile? Step 3. Start interval walking this week. 3 minutes brisk pace followed by 3 minutes easy pace. Repeat 5 times. 30 minutes total. 3 times per week. That specific protocol produced the 8 millimeter reduction in pulse pressure in the 2023 Journal of Hypertension study. Your doctor is already collecting the data that contains both of these numbers at every single appointment. The pulse pressure is in every blood pressure reading they have ever taken. The triglyceride to HDL ratio is in every lipid panel in your medical record. The numbers are already there. You just needed someone to tell you where to look. Drop your pulse pressure in the comments right now. Take your last blood pressure reading, top number minus bottom number, and post that number below. Under 40, 40 to 60, over 60. Your number helps every other viewer watching right now understand where they stand. If this video showed you something that was hiding inside data you already had, please share it with one person over 65 who has been told their heart health looks fine, Because fine and optimal are two very different things, and now they will know the difference. Every research source cited in this video is linked in the description below. Subscribe to Reclaim 60, new health research explained in plain English every single week. The information your doctor never had time to give you, right here. I will see you in the next one.